Hi, Ashley. My name's Liz. I'm the nurse practitioner who's going to be working with you today.
Okay.
We're just going to start by taking a general history, okay? Can you tell me what you're here for today?
Just a physical.
Okay. And how old are you?
19.
Okay. And then, so we're just going to start with asking some questions about your medical history, your surgical history, family history, things like that.
Okay.
Okay? Do you have any medical history, any diabetes, asthma, any issues with your heart
Nope.
or lungs? Okay. And then as far as your childhood goes, did you have any serious childhood illnesses like chickenpox, measles, anything like that?
Nope.
Okay. Were you frequently ill as a child?
No.
Okay. And then as far as surgical history goes, did you have any surgical procedures done or anything like that?
Just wisdom teeth.
Wisdom teeth pulled?
Yep.
Okay. All right. And but when did you have that done?
It was about a year and a half ago.
Okay. All right. And that went okay?
Yeah.
Okay. Any problems with the anesthesia?
No, I think it was just the amount of pills, and one day I just threw up once, but other than that, it seemed to go pretty well. I used up all the medication and healed pretty quick, so.
Okay, good. And then no other surgical history other than that?
No.
Okay. Any allergies at all to medications?
No.
Okay. And then any allergies to latex as far as you know?
No.
Okay. What about seasonal allergies?
Yes.
Okay. You have those in the fall or in the spring?
Both, just the beginning of fall, the beginning of spring.
Okay. And do you take something over the counter for those? Or?
Yeah, if it gets really bad, I'll go to the doctor and get a prescription, but other than that, I just do the over-the-counter stuff.
Okay. All right. And then what about food allergies? Any allergic to any?
No.
Okay. And bee stings?
No, I just swell up really bad, but other than that, my throat doesn't close up or anything
No
like that.
anaphylaxis, anything
No.
like that. Okay. Are your immunizations up to date as far as you know?
Yep.
Childhood immunizations?
Mhm.
Okay. Do you remember when your last tetanus shot was?
Probably like 3 years ago.
Okay. All right. And then do you get a flu shot every year?
Yeah.
Okay. And then probably you're too young for a pneumonia vaccine.
Yeah,
So,
I don't
okay.
think I've ever had
What
that.
about the meningitis vaccine? Did you ever have that? as far
I
as you
don't
know?
think so,
Okay.
but my mom knows it better than I do.
Okay. And then as far as medications, do you take any medications on a regular basis?
Just birth control, the Lolawestrin.
Okay. And then do you know the dose of that?
No,
Okay.
but it's very, very low.
Okay. And how long have you been taking that?
About 3 months.
Okay. And it's going okay?
Yeah, it's going really good.
All right. Do you take any over-the-counter vitamins or supplements?
Just biotin,
Okay. And why do you take that?
just for my hair and skin, just keep everything healthy.
Okay. And then do you take any over-the-counter like pain medications or Prilosec, anything like that?
Nope.
Okay. And then as far as the family history goes, are your parents living?
Yes.
Okay. Does your mom have any medical history to note? Okay.
Nope.
What about your dad?
Nope.
Okay. And about how old are they?
My dad I think he's like about 50, probably over, and my mom's in her 40s.
Okay. All right. And do you have any siblings?
Yes.
Okay.
Brother and a sister. They're 16, they're twins.
Okay. Do they have any medical history at all?
Nope.
Okay. All right. We're going to move on to some social history questions. Are you employed?
Yes.
Okay. What do you do?
I work at a nursing home as a CNA.
Okay. Great. How many hours about do you work?
24
About
a week.
24 a week?
Mhm.
Okay. And you enjoy that?
Yes.
Okay. And are you going to school?
Yes, I go to GRCC for nursing.
Awesome. Good job. That's wonderful. And school's going okay?
Yeah, it's going really good.
Good. That's great. Any alcohol use at all?
Occasionally, once or
Okay.
twice a month.
Okay. And how many drinks would you say you have?
2 to 4.
Okay. All right. Any history of tobacco use at all?
No.
Okay. Don't smoke. Don't chew.
I won't. I don't like it.
Okay. What about illicit drug use? Any
No.
history of that? Okay. And then what kinds of things do you do for fun with your friends?
I like to go outside, quadding. I'll start snowboarding here pretty quick because of the snow, horseback riding, just all the good outdoorsy stuff.
Okay. All right. Do you have any history of abuse at all?
No.
Okay. What about sexual abuse?
Nope.
That's good. And I'm going to ask you some questions about safety.
Okay.
Do you drive?
Yes.
Okay. Do you text and drive?
Occasionally.
Okay.
At the stoplight.
Okay. And do you wear a seatbelt?
Yes.
Okay, that's good. Do you have smoke detectors in your home?
Yes.
Okay. And are there any guns in your home that you're aware of?
No.
Okay. All right. I'm going to ask you some questions about your psychological history, okay?
Okay.
Any issues with depression or anxiety?
Nope.
Okay. Any history of schizophrenia, bipolar disorder, anything
Nope.
like that? Do you have any history of self-harm?
Nope.
Okay. No suicidal thoughts whatsoever?
Nope.
Okay. All right. Just ask some general health questions here. Fatigue. Any issues with fatigue?
No.
Like generalized weakness?
Mm-mm.
Anything like that? Fever or chills?
Nope.
No body aches?
No.
Kind of general weakness at all?
Mm-mm.
As far as your skin goes, do you have any issues with being extra dry or itchy?
No.
Any eczema, anything like that?
Nope.
Any abnormal moles or anything
No.
like that? Had any recent changes in your hair or your nails?
Nope.
Okay. All right. Any recent change in your weight at all?
No.
Okay. As far as your head goes, do you have any issues with your head as far as abnormalities at all?
Nope.
Okay. No problems with your hair?
No.
Okay. What about your eyes? Do you wear glasses?
Yes, I do.
Okay. And do you have contacts as well? Or?
No, they're mostly for reading and studying when I can't see stuff far away. I like to wear them when I'm taking notes in class and when I'm driving.
Okay. All right. Any blurred vision at all?
Mm-mm.
Double vision? Any spots, floaters, anything like that?
Nope.
Okay. Any issues with your ears? Any ear pain?
Mm-mm.
Frequent ear infections at all?
Nope.
Do you wear hearing aids?
No.
Okay. Do you have any problems hearing as far as like ringing in the ears?
Mm-mm.
Or you feel like you hear better out of one ear or the other?
Nope.
Any issues with your nose at all?
No.
Any pain?
Nope.
Okay, do you have frequent like colds or anything like
Mm-mm.
that? I don't feel like you have a lot of nasal drainage all the time.
No.
Any issues with bloody or bleeding noses?
I never get a bloody
Bleeding-
nose. Yeah.
bloody nose. Okay. Any issues with your mouth at all?
No.
Any lesions or sores or anything in your
Nope.
mouth, on your tongue?
Mm-mm.
Okay. Any frequent sore throats or anything like that?
No.
Okay. I forgot to ask you. When did you last see the eye doctor?
It was about September, so just a couple months ago, because then I got my new glasses.
Okay.
They were pretty out of date prescription-wise, so.
Okay. All right. Sorry. Back to your mouth. Any issues with your teeth at all?
No.
You brush your teeth regularly?
Yeah, 3 times a day.
Okay. Do you see the dentist regularly?
Yep, every 6 months.
Okay, perfect. And any problems with multiple cavities, anything like that? Mouth sores?
No, I have a cavity every time I go, but just because of the way my teeth are shaped, apparently.
Okay. All right. And then no frequent sore throats,
No.
anything like that?
Mm-mm.
Okay. As far as your neck goes, do you have any pain in your neck? Do you feel like it's difficult to get full range of motion or
No.
anything like that? Okay. And then your throat, you said you don't have frequent sore throats. But,
Nope.
Have you had any issues with your thyroid at all?
Mm-mm.
Okay. No masses or lumps or anything like that? Never
Nope.
difficult to swallow?
Nope.
Okay. And as far as your lymph nodes go, like swollen under your neck or in your armpits, anything like that?
No.
Never had any swelling or tenderness?
Mm-mm.
Okay. And do you do self breast exams?
Yep.
How often?
Whenever. I mean, maybe once a month.
Okay. All right.
I haven't noticed anything.
Okay. And have you had any issues with your breasts at all? Any
No.
lumps, bumps, dimpling, anything
No,
like
just
that?
the occasional tenderness, but that's probably with periods and whatnot. So.
Okay. All right. And then any issues with your nipples at all? Any cracking, drainage,
Nope.
bleeding, anything like that?
Nope.
Good. As far as your respiratory history goes, any problems breathing at all?
No.
Any wheezing, frequent coughing? And is it ever difficult to breathe, like short of breath?
No.
Okay. And is it difficult to breathe when you exert yourself?
No.
Okay. And then your cardiac history, any ever feel like your heart is racing, skips a beat,
No.
anything like that? Okay. And no, you said no cardiac history, so you've never had any like hospitalizations, anything like that because
No.
you have a difficult time breathing. Have you ever passed out?
No.
Okay. And then do you have any problems with swelling like in your legs?
Mm-mm.
Okay. Your abdominal history, do you have any problems with your stomach at all? Any pain?
Mm-mm.
Okay. Any issues with nausea or vomiting?
Nope.
Constipation or diarrhea?
Nope.
Have any hemorrhoids?
Nope.
Okay. Could you tell me a little bit about what your like normal diet would be?
It depends on what's in the house. I like to eat healthy, but I also like junk food
Okay.
occasionally. So it just depends on what's available.
Okay. Do you drink a lot of water?
A lot of water.
Okay. Do you drink caffeinated drinks?
I drink about a cup of coffee a day, and then tea when I get sick. But I don't really like pop.
Okay. All right. And then, as far as urination goes, is it ever difficult to urinate?
No.
Painful at all?
Mm-mm.
You feel like you empty your bladder all the way?
Yeah.
Okay. Any history of kidney stones?
No.
History of urinary tract infection?
I've never had any UTI.
Okay. What about pain in your back,
Mm-mm.
where your kidneys are?
No.
Okay. Do you have frequent yeast infections at all?
No.
Okay. All right. And then you said you're on birth control?
Yes.
Okay. And you take it pretty regularly?
Yep. Every night between 6 and 9.
Okay. All right. And don't miss it?
No.
Okay.
I never miss it.
Okay.
No. Gotta make sure.
Okay. And then any issues with your periods at all?
No.
Okay. Do you have one regularly?
Yeah, they're just really short because my birth control makes it so I don't have them at all.
Okay. All right. Any menstrual cramping, pain, anything like that?
Nope, used to, but not anymore.
Okay. All right. And then are you sexually active?
Yes.
Okay. And then do you have one partner?
Just one, yep.
Okay. And prefer men?
Yes.
Okay.
Yep.
Any issues with that at all? Any pain with sexual activity, anything
Nope.
like that? Okay. Did you receive a Gardasil vaccine that you recall?
Not that I recall.
Okay. All right. And then when was your first menstrual period? When did you start having
About
periods?
8th grade, so when I was 14, 13, something like that.
Okay. All right. Gonna move to your muscles and your joints. Do you have any pain in your muscles or joints?
Nope.
No swelling, difficulty with motion, difficulty doing regular activities, anything
Mm-mm.
like that. Do you ever have any muscle weakness?
Nope.
Okay. Have you ever had any fractures?
No.
Okay. And then as far as you said you have the headaches
Yep.
on occasion. You have any numbness or tingling anywhere?
No.
Okay. And what about just generalized weakness? You said no.
No.
And do you ever have any issues with vertigo or dizziness?
Nope.
Okay. And then as far as your endocrine goes, it's kind of any issues with diabetes. But do you have any issues where you feel like you're thirsty all the time?
No.
Go to the bathroom all the time?
No.
Any intolerance to heat or cold?
No.
Okay. And then anything else that you want to discuss that we haven't?
Nope.
Okay. All right. Probably have you get into a gown and we'll do a physical exam.
Okay, sounds good.
Thanks so much.
Yep.